Hi winners, this is Dr. Srikanth from team Mdsconquer. So now I'm going to give a brief idea that how you need to handle this particular combination. Okay, the combination of general medicine plus general pharma plus dental pharma and physiology. Okay, the first and foremost thing is, so most of these subjects which I have mentioned are integrated with every subject in your preparation. Let's you take general anatomy. Yes, of course it is integrated. There are areas like nerve system, it is integrated. There are many things it is integrated. So every subject has an integration. Like you take oral surgery, medical emergencies will be integrated of your general medicine. General pathology is integrated, oral pathology is integrated, oral medicine is integrated, pedo is integrated, perio is integrated. So all the subjects are directly or indirectly at least like 10%, sometimes 20% will be integrated with this particular combination. You take endo, you have drugs, right? So drugs will come under pharmacology. You have acute infections, chronic infections, that will be a part of your medicine and physio, the physiopathology and everything will be. So the next 30 to 35 days, you will be focusing on this particular combination. So, let it be a NEET blueprint or INICT blueprint. So, if you take INICT general medicine, as it is integrated to most of the subjects, it is being ignored as a suggestion by most of the mentors, but questions will come directly or indirectly. So, your general medicine according to NEET blueprint is going to carry 15 marks. Your general pharmacology is going to carry 7. General pharmacology means not the chapter general pharmacology. Pharmacology, which is in general, means all the system-based pharmacology like GIT drugs, CVS drugs, CNS drugs, ANS drugs, okay, the other endocrine drugs and everything, they are considered as general pharmacology. And the next one is your dental pharmacology. Dental pharmacology is basically your LA, local anesthesia, which is part of your oral surgery, your general anesthesia, which is a part of your oral surgery and general surgery, and it will be coming under general medicine. Emergency drugs in your wards, and followed by most of the dental related, let it be mouthwash is also going to come under in dental pharmacology. You say the drugs used in endo procedure, like what is triple antibiotic paste, what is modified triple antibiotic paste, and what are the drugs which are very specific to each and every condition of your perio. Let it be what are the drug of choice in the case of ANAC, what are the drug of choices in the case of refractory periodontitis. There are many things, like you say, like the complication of your COVID-19 mucormycosis, what is the drug of choice used. So all these are directly or indirectly related to dental pharmacology questions. Okay, you see what is the drug of choice for oral syphilis, what are the drug of choice for candidiasis, what are the drug of choice for the denture stomatitis. So all these are going to come under your dental pharmacology, which will be integratedly covered in all the subjects when we are discussing about the treatment plan, drug related treatment plan of that particular condition. You, like for example, you're talking about gingival hypergrowth, okay, the perio stuff, okay, drugs which are causing the gingival hypergrowth, that is going to be part of your dental pharmacology questions. And the next one is physiology, which is going to be 7 marks for your examination, because physio and biochemistry together is going to carry your 14 marks. So physio is going to be 7 marks. So here the most important thing is, for any disease, okay, so I'm just giving an outline. For any disease, you talk about a disease will have pathophysiology. So normal physiology you will be discussing in your physiology chapter. Pathophysiology will be discussed in general pathology, but general pathology, system-wise pathology is not important for a dental student. So because pathology is going to carry 7 marks only for us, so we don't focus on pathophysiology mainly of all the systems. We'll be focusing on very limited area. So pathophysiology, what we are going to learn system wise is integrated with general medicine for a dental student. It will be different for a medical student, it will be different for a dental student, and followed by the clinical features, and everything will be discussed in subjects like your general medicine, oral medicine, and the treatment plans will be discussed in your pharmacology. That is, drug related treatment plans will be discussed in pharmacology, other treatment plans will be discussed in general medicine, and surgical treatment plans will be discussed in your general surgeries and oral surgery. So all of these subjects for a particular disease or a particular system are integrated to each other. So here I told you to follow a particular principle called as D and C. What is this D and C? D for divide and C for conquer. So here the most important thing is take your body, your entire body, divide it into different systems. Okay, you have CNS, head is going to focus on, like you have head is going to focus on CNS. Then there is something called as a renal system. There is something called as a renal system. There is something called as a reproductive system. There is something called as a respiratory system. There is something called as cardiovascular system. There is something called as nerves and muscles. There is something called as bones. So first of all, I want you to divide the entire combination of this physio, pharmacology and general medicine. You divide it into system wise. This is how I have prepared the schedule. This is how I have prepared the smart videos. This is how I have prepared the content, and I tried my best to integrate with each and everything so that your reading will be easy and your reading will be meaningful. So normally you open physiology, mug up physiology without understanding the concepts. Okay, then you don't interlink those physiology to that of your general medicine. You don't link your general medicine to pharma. It is not a right way of preparation. So most of the dental students in this last 8 to 9 years of my experience, along with my preparation of 2 years, okay, let consider it as a 10 years of knowledge over this mode of preparation. Any student throughout the preparation, they are going to come out and tell me that the most difficult combination for me is this particular combination. But if you read this in a proper way, in an organized way, in a way that how we are guiding, these things looks going to be simple. These subjects are going to decrease your psychological pressure, and these subjects are going to give you more confidence in handling the examination. Okay, right? So considering this, so I have divided into these parts. Like, okay, you see, first I kept general pharmacology, which is the raw basics of pharmacology, how this pharmacokinetics, pharmacodynamics, what is zero order kinetics, what is first order kinetics, drugs which are following first order kinetics, drugs which are following zero order kinetics. You have different phases of testing of your pharma drugs. So there are lots of things like which will be discussed in this particular subject, particular chapter. So I have given 2 days for this in the schedule. Okay, then I kept GIT. Okay, GIT I have given you 3 days. Okay, where you are going to learn the basics of in the physiology. Then in general medicine, you will be focusing mainly on the important things. Like the first important thing is GERD is very, very important, your Barrett's esophagus and everything. Then peptic ulcer is important, duodenum ulcer is important. Ulcers, your peptic and duodenum ulcers are important. Your inflammatory bowel diseases are important. Apart from this, you can focus on hepatic system, different types of like hepatitis, what is A, B, C, D, E, and followed by you have jaundice. Okay, and all these things will be you have to cover. It is very topic specific. Okay, because general medicine is not the same general medicine what your medical MBBS friends are going to read. So most of our questions will be on topic specific. Means for a dental student, if it is a GIT based system, so these are the topics which has to be covered, and most of your questions, more than 95% of your questions will be on these topics only. Similarly, now drugs. Okay, what are the drugs which are very, very important? Not all drugs are important for a dental student. There are few drugs which are covered in the videos are important. You read them, that is more than sufficient for you to handle more than 90-95% of the questions in the examinations on this particular subject. Then I kept respiratory system. So respiratory system, 2 days is sufficient. You can learn your physio, that is your lung volumes, lung capacitance, oxygen dissociation curve, carbon dioxide dissociation curve, okay, and all these things. And you have a particular disease like asthma is very important, COPD is very important. Like in the recent NEET examination, you have some questions on the chest x-rays. So chest x-rays top to bottom of all the diseases will be discussed. COVID-19 will be discussed here. Okay, COVID-19 will be discussed in your respiratory. There are a few other respiratory conditions which are important, will be discussed along with the drugs used in the respiratory system. Then I kept nerve physiology and muscle physiology. I have kept 1 day where you are going to talk how the conduction will take place, how the muscle contraction will take place, what are the different types of nerves, what are the functions, and everything will be covered here. Then I kept 4 days for your infections. Infections is a general topic. It's a general topic. It is covered in general surgery, it's covered in oral pathology, it's covered in oral medicine, it's covered in general path, it's covered in general medicine. Everywhere it's going to cover. So bacterial, viral, and fungal. Even in microbiology, infections will be covered. But parasitology is also important, but you can do the parasites, a limited number of parasites, that is your Entamoeba histolytica, your Taenia solium, Ocularia bancrofti, and all these are minimal parasites that you have to make it out. Particularly malaria is again one important parasite, but I want you to focus mainly on these three for these 4 days, and I want you to cover. Okay, and then I have given 1 day extra for infections. If you want, you can keep it as a revision. Then followed by I kept CVS. I kept CVS for 4 days. Okay, you need to focus more on hypertension, infective endocarditis. You have to focus on MI, you have to focus on ECG, you have to focus on wall defects. Mitral wall defect is very important. Heart failures, how you can differentiate left and right heart failures has to be covered. Then endocrinology, I have given you 3 days time. Basic physiology, hormones secreted by each glands, what are the abnormal conditions, diabetes mellitus has to be covered top to bottom. And in this I have included the reproductive system, not very important for a dental student, but I have included reproductive system. I have taken male female reproductive system classes, the basics which are important to learn from physiology aspect. Maybe general medicine related stuff are very less from the reproductive system for a dental student, but physiology based questions can be asked. Then renal system I have kept 2 days. Then blood I have kept 5 days. Okay, then CNS plus CVS I have kept 4 days. CNS and ANS is 4 days plus sense organs 1 day. Okay, right? So endocrine I told you, right? So coming to the renal system, I want you to focus mainly on the physiology. Questions on general medicine part will be very less. Diuretics has to be done. Then coming to the bloods, anemias are important, leukemias are important, anemias are important. Basic physiology of the blood is very important. CNS neurologists are important, trigeminal neurology is important, glossopharyngeal is important. So everything will be given as a proper checklist, as a system wise for you, so that you can focus on. So the logic here is, what is this D&C principle? D&C principle is, don't see all these things at a shot, you will get panic. So first of all, I want you to divide and rule. Okay, so how you can divide? This is part 1. This is your part 1. Okay, basics of pharma. GIT 2, respiratory 3. Nerve and muscle is very simple, no need to break your heads. Infections, don't consider it as a system. Infections you can clinically correlate, you know more about infections, so infections is going to be interesting. Okay, right? So 1, 2, 3, CVS is 4, endocrine reproductive is 5, renal is 6, blood is 7, ANS and CNS plus your sense organs is 8. So these are the 8 things that you have to focus on. Okay, it's going to be interesting. Okay, it's going to be fun. The only thing is you have to give a good time. And second thing, as a dental student, we are not exposed to wide range of general medicine related cases in our clinicals. It's an open secret. Okay, the exposure is very, very limited. Here you should have that imagination. You should draw that animation diagrams. You should draw the rough diagrams. You have to work on understanding the concepts to make this subject interesting. Okay, the logic here is, even if you don't understand the concept, you can easily answer that 60 to 70 or 70 to 80% of the questions in the exam. That's not a problem, because most of them general medicine related stuff or physiology or pharmacology related stuff, they are going to ask you integrated with the dentistry only, so you can answer it. But to make this subject interesting, or to make this combination interesting, you should be more involved in this. You should have that particular passion of imagining the things and correlating them clinically. Okay, and getting some analysis and getting some concepts, because the medical emergencies in your future dentist, even if you open a clinic, or even if you even if you are practicing, or you take oral surgery, or you take pedo, you can encounter these medical emergencies in your clinic, in your scenario, and the knowledge what you gain is going to help you to solve questions in the exam, and of course help you to give some proper idea about the future medical emergencies in your clinic or in your clinical scenario where you are going to work. So this is an outline. Okay, and you have good number of smart videos. Okay, and you have mentors associated with you to help you in telling the concepts, taking the care, and a proper checklist for every system will be posted to you on the group. Okay, as a system wise, and let's do this, let's work hard. Okay, we have 3 to 4 mentors handling this particular combination available for you all the time for this upcoming 35 days. Okay, and let's do it. Okay, let's enjoy this particular combination, the toughest combination, the most interesting combination, and the combination which is going to yield you the best ranks. Okay, if you're targeting 500 below, if you're targeting for a government dental college, this combination is damn important. Okay, because it's, you understand the things, you organize the things, it's going to save your time during the revision process, it's going to decrease your stress during the revision process, it's going to increase your confidence during the revision process. Okay, so I'm signing off now. Take care. Rest everything will be posted on your groups. Let's do this subject together. Okay, I'll be with you, I'll be reading with you, I'll be helping you in all the possible ways to handle this particular subject. Take care. Bye bye.